Hi, everyone. How are you today? My name is Holain Karemu. You're welcome to Synergy International Nursing Network OET Study Buddy. Today, I'm going to be sharing with you 10 speaking role play templates. For the OET speaking exam, you are required to, do 2 role play, and you'll be given 2 role play cards and tasks to do. So generally, I'm just going to walk you through what you're supposed to do, what you're supposed to say, what you're expected to go through for your OET speaking. Not as straightforward like that, but if you keep this in mind, if you can practice with this, it's going to really help you on your test dates. Now, I need to say this clearly that this is not an automatic format. It's just based on practice and based on experiences, that these are what you can do and what you can take note of when you're preparing for your OET speaking. If you follow these 10 role play templates, speaking role play templates, is going to help you a lot to master yourself, to master your speaking skills and so on. So come with me. Number 1, there is how to start your introduction. For every speaking role and for every time you're having conversation with anybody, especially in the OET speaking, this is going to be with your patient, a family member, a colleague, or maybe a caregiver as well. So definitely, just like every conversation and every communication channel, you need to introduce yourself. Now, a lot of time, people don't know how they should properly introduce themselves or how they should properly start a conversation. So far more than preparing for an exam, this is also going to help you as healthcare professionals on how to start conversations in the healthcare setting. Now, think of it, you are in front of the patient, you have a patient that comes maybe for consultation or maybe in the ward, going on discharge and so on. How can you introduce yourself? So you can start by saying, if you are a nurse or a doctor, so let's take an example of a nurse, okay? So you start by saying, good afternoon, my name is nurse so, or you can just say, my name is Ola, I'm your nurse today. How can I help you? Okay, then the patient will say whatever they want to say. Or you could just say, maybe if it's for a follow-up visit, you can say, good afternoon, nice to meet you again. How are you so far? How can I help you today? So that's a way of introduction. So we need to put ourselves, it's not just enough for you to say, hi, hello, what's your name? You need to introduce yourself first. Even if you want the person to introduce themselves, then you can ask, how may I help you? Or how do you prefer to be called? What's your name? Can you tell me your name? So you introduce yourself first, and then the person also introduce. You can ask, kindly, can you tell me your name? So how may I call you? How would you like to be addressed? All right, so that's about introduction. I hope that is taken. If you have any question regarding any of this part that I'll be talking about, please feel free to ask. You can drop it in the comment section in the chat box. Now, the second step there, or the second thing to take note of, most of the time you will have role play that you have to interact with a patient that maybe is grieving or lost somebody or so. So you have to show empathy, and if a patient is expressing pain or expressing anything that's not pleasant, you have to show sympathy, show empathy, and also it's important that you take history. I'm going to be putting these two together. All right, so how can you start to show empathy and history, and to take history? So starting, That's the first thing. You need to start somehow. So you can say, oh, I'm really sorry to hear that. For example, if a patient tells you that, oh, I have terrible pain in my tummy, or I feel so much pain in my tooth. So just how to engage. How can you start? You can say, oh, I'm really sorry to hear that. It must have been very painful. You can say it must be stressful for you, but I can understand some question first. You can say, I can understand this is very stressful for you, but can I ask you some question? You can say, oh, I'm so sorry, sir. I appreciate your fears and your concern. Would you mind if I ask you a few further questions? So you're combining your act of showing empathy or sympathizing with the patient, as well as you taking history. Now, the second part in that regard is to clarify. How can you clarify information from a patient? If the patient had told you something, for instance, let me say the patient told you, oh, I've not been eating well for some days. You can clarify and say, what about your appetite? Are you eating well? You can say, do you say anything? Have you had any symptoms like? Could you describe your pain? Does it occur all the time or just now and again? Does anything seem to bring it on or aggravate it? You're trying to clarify and get more information. That is taking history. I hope that is taken. Now, the other thing there that you also have, the third thing you have to do in this regard is you might want to go ahead and know what is the site of the pain, where's the location of the pain, where is it affected? You can say something like, can you tell me where it hurts? Could you tell me where the pain is? Or you can say, which part of your body is affected? That will help you to get more information. Also go ahead to ask maybe the duration of the pain or duration of the problem. You can say, how long have this been? You can start like that. Now, the last part of that, how to show sympathy and to take history, is how do you end that part? You can say, have you tried any medication? Is there anything else that is bothering you? So always try to ask open-ended question. I think in another video, I'm going to talk about the questioning when it comes to OET speaking, how to question your patient. Now, number 3 step there in the OET speaking template is diagnosis. How do you establish diagnosis, or how do you explain to your patient what a diagnosis is or something? If the patient is diagnosed or something, how do you explain? So you can say something like, well, based on your symptoms and after examination, especially according to the doctor, I believe that you have what is called, or you have been diagnosed of so. Say you have been diagnosed of constipation. And let me explain what constipation means. Then you can go ahead and explain what constipation means very briefly. You can go ahead and say it is caused by this, and by that, and it can be treated by this and this and this. So that is how to establish diagnosis, or to tell your patient what the diagnosis is all about if they ask. Now, the fourth template there is management. When it comes to you explaining the management of a condition, you're going to have a lot of role play cards that will tell you to explain a condition or management or treatment procedure for a patient. So you really need to know how to start that conversation. You can start by saying, I think we should start with so. I think we should start with what you can do to make you feel better. Then go ahead and talk. So you need to, first of all, introduce what you want to say or what you want to explain, and then go ahead to explain it. You can say, first of all, it is also important for you to do this. There are some more effective strategies to cope with, name the condition. Or you can say, I see that you must be experiencing some difficulty understanding the treatment procedure. But the good news is, then go ahead and say what you want to say. You can ask the patient, would you like to hear more about the treatment options? Is this a good time to start your therapy? This also helps your patient to, voice out their feelings and so on. So that's kind of how you can have that conversation of explaining the management or treatment for your patient. Let's go to the next. Now, this is a very interesting part that most likely you might not, you won't miss this kind of scenario or role play where you have to reassure a patient so well. So how can you reassure a patient when it comes to OET speaking or generally in the healthcare setting? You can say something, let me reassure you that eczema is self-limited, or don't worry, if you can follow my advice, you will get much better soon. Or you say, don't worry, it will go away by itself in a few days with some rest. You can say, I know it sounds difficult at first, but with practice, I am sure you'll be able to. Another one you can say is, I am sure you won't have any more problem. So these are ways you can reassure your patient about a situation or a condition. Let's go to the next one. Now, this next one is when you have a difficult patient or a reluctant patient, maybe a patient that is refusing medication, refusing to, to comply with a particular management interventions. How can you persuade the patient without forcing, your opinion on the patient? So if a patient tells you, no, I don't want to use this medication. No, I'm not going to use this medication. No, I'm not going to do this. I don't want to do this. So you can start by saying, I really appreciate your concern, or I can understand your worries, or I know how you feel, but let me tell you this. Then you go ahead and explain. Or you can say, I understand completely your busy time, but your health is my priority. What is more important is your health. So that is how to, to start that kind of conversation. You can also say, let me assure you, if you follow my advice, the risk of heart attack will be greatly reduced. However, if you do not follow my advice and continue to smoke, then the risk of heartache is much higher. See, that's a very kind way of you telling the patient the risk of them, not complying. You can also say, let me explain to you why the insulin therapy is necessary for you. Another thing to say, maybe, of course, you will need to continue. However, I don't think this will be helpful for you. So those are ways you can persuade a reluctant patient. You can say, finally, after agreement, I'm pleased to hear that you will continue to take your medication. So if the patient finally agrees, then you can always conclude that part. Next. Now, most of the time we give information, we dish out a lot of information, especially when a patient is going on discharge. There's so many information. It is important that we take time to check that the patient understands what we are saying or what we have said. How can you check for understanding from your patient? Now, you can say something like, is that clear? That after making a statement or to saying something, you can ask the patient, is that clear? Am I clear so far? How does that sound? Am I clear till now? You can say like, do you think you can do that? Do you feel comfortable about my advice? Do you have any questions so far? And my favorite part of this one is saying, would you like me to tell you more about that? So if the patient say, oh no, I'm fine. So Or patient say, yes, can you tell me more about so you know that you need to explain better. So it's very important that you check understanding. All right. If you can ask your patient question as well by checking their understanding. Can you tell me what I just told you? Or, you know, understand, can you summarize what I just told you? So that's another way of checking understanding. Now, the next one is signposting. So a lot of people ask me this question and they get kind of confused about this. Signposting is different from labeling. So if you want to say something, you have a list of things you want to say, you can signpost. Like you can give like just like it sounds, sign. You can create an awareness of what you want to say. Like, now I'm going to talk about this. Now I'm going to do this. Then you go ahead and say what you want to say. Now, first of all, you can say, first of all, you have a list of things you want to say. You can say, first of all, as I said before, or as I told you earlier, because I'm concerned about your smoking habit. It is important to stop smoking. You are re-emphasizing, you are signposting, stopping smoking. You can say, I have to highlight, or I have to emphasize the importance of whatever. Or you can say, it is very beneficial for you. Another way to signpost it, I recommend that, I strongly advise that you lose weight. Now, another way you can signpost is say, for this reason. You can use words like, for this reason, therefore, however, in addition, also, now. So when you start the statements with those words, you are signposting, you are calling the attention of your patient to what you're saying at that particular time. Okay. Now, let's go to the next one. Now, how do you end the conversation? You'll be having a conversation of 5 minutes, usually per role play card. How do you end the conversation? The common way to end the conversation is to ask, do you have any more questions? Hope you feel better soon. I wish you a speedy recovery. You know, just make sure you are ending the conversation. You're not just, oh, okay, I've talked about everything I want to say and just keep mute. You need to end the conversation nicely. You can say something like, I would like to see you in the week. Don't hesitate to call me if you have any concern. So those are ways you can end the conversation. And the last thing I'm going to talk about here, you remember I said that this is not just like, it's not a jackpot or a universal template you can adopt. This is just something you can practice with. Now, there are special cases that you need to pay attention to. I have about 7 here, although there are more than that. So I call them special cases. And how do you respond to these special cases? The first case there that you may come across is when you have to break bad news. Breaking bad news. Okay, so let's take, for instance, June. That's the name of a person, June. We have the test result back, and I'm sorry to tell you that the cause of your symptoms could be more serious than you think, and there is a risk that so. That's a very nice way to start, you know, that kind of conversation. You can say, fortunately, we caught it earlier, and there are some treatment options such as chemotherapy. We will keep a close on you and be sure you are in good hands. It may be a good idea to talk to somebody about it. Do you have any relative or close friend who can help you and provide support? So that's kind of a sequence of how you can break a bad news. So tell the person about the situation, tell them, take pause. It's important that you take pause. You can say, I realize that this come to you as a shock. Take a pause there. Then you can go ahead and say, it is very important that we do feel further investigations, including this and this and this, as the doctor has, recommended. So take that step and make sure that you go ahead and ask questions. Do you have any relative, or is there anything I can do to make you feel better? That's one way to, have that breaking boundaries conversation. Another special case is when you have to refer somebody to a dietitian. This generally has to do with diet. So you can say, now regarding your diet, I can refer you to a dietitian and they can provide really good guidelines and healthy food options. So that's just very straightforward. Another one is when you have to refer a patient to physiotherapists. You can say, one way to speed up the recovery process and to increase mobility is to visit a physiotherapist. This they will be able to design a rehabilitation program based on your needs. Would you like to try that? So if you recommend something or give an advice, always get that feedback if the patient accepts it or not. Another special case is when you have to advise a patient on quitting smoking. So how to quit smoking, you can say, now, in order to quit smoking, I recommend that you attend the hospital quit smoking program. They run regular classes, and I can tell you that it has helped many patients. Would you like to give it a try? So remember, if you make any recommendation or advice, always clarify, get maybe the acceptance, confirm acceptance or rejection of your idea. Another special case is when you're talking to, you have a situation of alcohol addiction. You can have that conversation like, it's quite a serious condition and you really need some outside support to help you overcome this. Therefore, I recommend that you contact Alcoholics Anonymous, or I can contact them on your behalf and arrange appointment. How does that sound? You see how I ask question again to confirm, the acceptance of my opinion or recommendations is very important. You can have another scenario of helping a patient to start insulin. So when a patient has to start self-injecting insulin, you can say, I understand that self-injecting insulin can be challenging at first, but at our clinic, we run weekly training programs, which are run by the nurses. We can take you through the process step by step and help you gain confidence. Would you like me to make an appointment for you? Okay, again, don't forget to check for confirmation of, whatever recommendation you have given. And lastly, when you have to advise a patient on any exercise program, a patient on exercise, you can say you need to start an exercise program as recommended. You can join a local gym or sports center. They'll be able to create a fitness program that can help you lose weight and feel healthier. Do you think you can do that? All right, so it's been an amazing experience sharing these tips of OET speaking template with you, and I hope you have gained one or two things from this. So if you have any question, please feel free to ask me. You can send it in as through chat or comment, or you can send it via email, info@synergynurse.co.uk. You can send it through the WhatsApp there. Visit our website at www.synergynurse.co.uk. If you want to enroll for the OET study buddy with Nurse Koshola at Synergy, please feel free to contact us. You can also send us an email. I'll be glad to have you. Remember, with Synergy Nurse, your OET is just at one pass. Thank you. See you some other time.